Welcome back, everyone. We are moving into the last portion of our second pre-license of our last pre-licensing session. Thank you for being flexible as we move through our technical difficulties. If you are still unable to access the live Q&A, please go ahead and put all your questions in the live help option, and our technology services will let us know what those questions are. If we can get those questions answered, we will. Otherwise, we may need to take them back. And as a reminder, we have a satisfaction survey that was sent to emails this morning, and we would appreciate if you could fill those out at your convenience. We have Amy and Shelley presenting on the introduction to insurance from OCI once again.
Good morning. This is our third and last slide deck, and it's actually regarding the Affordable Care Act for the Navigators and the CACs. We'll just give it a second to get up on your screen here. Are we able to see that? I'm not, but okay, my apologies. So I apologize for the awkward delay there for a moment. So, our mission statement, the Office of the Commissioner of Insurance, provides the context in which OCI goals and strategies are formulated, depicts the scope and direction for the agency, and provides the framework within which decisions will be made regarding programs, proposed legislation, and rules and administrative goals. OCI's mission statement was updated in 2021 to reflect the modern insurance industry and the current goals in the office. The mission statement is core to OCI's operations. Next slide, please. The definition of a navigator is that of an individual or an entity that supervises or employs an individual who performs an activities and duties related to the Navigator program on behalf of the Federal Exchange and who receives funding to perform such functions on behalf of the Federal Exchange. An individual navigator does not include a person acting as an insurance intermediary. We will dive into the specific licensing requirements for a navigator and certified application counselor in the next few slides. Next slide, please. A certified application counselor, also known as a CAC, is a non-navigator assister who has been designated by or working on behalf of the Federal Exchange. Along with any federal training requirements, CACs are required to meet the training and examination requirements established for navigators, including the 16 hours of pre-licensing training and a successful passage of the written examination. Once the requirements are met, a CAC is not licensed by OCI, but a certification form must be submitted by the organization for the organization that the CAC is working for. Next slide, please. This is how the landing page looks on the OCI website for information about navigators and CACs. By clicking on the plus side towards the right-hand side of the page, a drop-down opens and information is provided about the requirements needed prior to the exam, the study materials for the examination, links to sign up for the exam and fingerprinting, FAQs, and other important and helpful information. This will be your go-to page for information and procedures about becoming a licensed navigator or CAC. Next slide, please. These are the straightforward 7 basic requirements in order to become a navigator. Any pre-licensing training such as this ensures a uniform, basic knowledge for those assisting consumers. Next slide, please. So we've come to the first of our polling questions. We do understand there could still be technical difficulties involved with this. Worst case scenario, like Elizabeth said, please go ahead and put it in the live support, your answer. But the question is this: which of the following is not a Navigator licensing requirement? A, be fingerprinted and received a background check. B, be appointed with an insurance company. C, be a resident of Wisconsin. Or D, be affiliated with a Navigator entity. We'll give you 30 seconds. Okay, a couple more seconds. Okay. And for those of you that answered, again, through the live support or otherwise, the answer is B, be appointed with an insurance company. Next slide, please. Agents that hold an active resident license with the Accident Health line of authority and complete the Wisconsin and federal training to be a navigator may apply to be licensed as a navigator. An agent cannot have any active company appointments with a health insurance company and cannot receive commissions from the health insurance company to act as a navigator. Agents must be certified by the Federal Exchange as a navigator and be affiliated with one of the entities that received a federal navigator grant. Next slide, please. Here are the initial requirements a navigator needs in order to become licensed with the Wisconsin Insurance Commissioner. As I give you a moment to review all of these requirements, I remind you again that this information can all be found on our website with links to sign up for the exam, submit the fingerprinting, and submit the electronic application. Next slide, please. If a license is revoked for failing to pay fees or not obtaining the continued education requirement credits, there is the ability to regain that license by completing all of the requirements noted in this slide. Next slide, please. Individuals working in settings such as federally qualified health centers, hospitals, healthcare providers, social service agencies, local health departments, and Indian Health Services who do the following must be registered with OCI. Those who help consumers fill out electronic and paper applications to establish eligibility for the federal exchange and public assistance programs, and those people who help consumers enroll in coverage on the federal exchange. A CAC is asked to complete the same initial pre-licensing requirements as a navigator, including again the 16 hours of pre-licensing training and successful passage of the written exam. These are in addition to any federal training requirements. Entities employing one or more non-navigator assisters are required to provide the Commissioner with a list of all certified application counselors that it employs, supervisors, or is affiliated with once the individuals are authorized by the Federal Exchange to provide assistance. Entities employing, supervising, or affiliated with CAC counselors assume legal responsibility for the acts of those counselors. Next slide, please. Although similar in base knowledge requirements, CACs are held to a different standard than navigators, but are still expected to be neutral and informed in order to provide a consumer with the best possible experience in choosing their health care. Next slide, please. Enrollment into a qualified health plan on the federal marketplace. Navigators and CACs can refer consumers to insurers or licensed agents if consumers are interested in products off the federal exchange. These will be without the advanced premium tax credit or subsidy assistance, but maybe become more affordable for the persons who are not income eligible for the perks on the marketplace. Such permitted activities are conducting public education activities to raise awareness of qualified health plans within the federal exchange, distribute fair and impartial information concerning enrollment in a QHP through the federal exchange and the availability of premium tax credits and cost sharing reductions that may be available, explain that consumers may purchase health plans through the federal exchange or off the exchange, make consumers aware that plans are available in the outside market and that they may want to talk to a licensed health insurance agent about health insurance options, facilitate enrollment in a QHP through the federal exchange, outline information that a consumer will need to have available when applying for coverage through that federal exchange, and providing information that will allow the consumer to access federal exchange either at their home or a computer terminal provided by the navigator. They need to consumer the following information: potential eligibility for public or governmental programs, how the federal health insurance premium tax credit and cost sharing reductions work, and their risks, if any, for use of the federal health insurance premium tax credit. They need to describe the features and benefits of health coverage in general terms, including cost sharing mechanisms like deductibles, co-pays, or coinsurance, and how these work or affect the consumer, and also what a summary of benefit document is and where to locate that document, and relevant cost sharing provisions within the information from the QHPs. Explain how to find information about provider networks and describe the different metal tiers, like we talked about earlier, the bronze, silver, gold, and platinum, and how these benefits may change at different metal tiers based on the consumer's income. And lastly, provide a referral for an individual to an appropriate state or federal agency who has a grievance, complaint, or question regarding their health plan, their coverage, or determination such as a plan or coverage. Next slide, please. Navigators are to be neutral providers of information, a valued resource in a complex field. Neutrality is key. The hope is to guide or navigate health insurance networks, costs, and guide they can make the best informed decision on their health insurance, balancing affordability and tolerance of risk. Some prohibited activities are providing any information related to enrollment or other insurance products not offered in the federal exchange, make or cause to be made false or misleading statements, provide advice comparing health benefit plans that may be better or for worse for the consumer or employer, recommend a particular health benefit plan or insurer, or advise consumers or employers regarding a particular health benefit plan selection. And lastly, engage in any fraudulent, deceptive, or dishonest acts or unfair methods of competition. Any individual or acting, any individual or entity acting in violation of the law provisions may be subject to an administrative action, including restitution or limitation or revocation of licensure or registration. All licensees need to comply with the post-brief notifications requirements unless they are subject to HIPAA. Next slide, please. Here is a breakdown of the Navigator exam. This slide provides you with a line by line comparison of what sections the question for the exam derive from. These are the areas of content that you need to focus on. For example, there will not be questions on the exam about the history of health insurance as they're not relevant. OCI expects all individuals who are guiding and assisting Wisconsin consumers on the complex matters of health insurance to understand this material and provide the best possible support to those they are helping, as that is what they expect from you. All of these tools can be found on our Navigator guide online. Next slide, please. This is just a general summary slide again of the information a candidate can find on our website surrounding the requirements needed and how to register for the exam. Next slide, please. The ACA enrollment period is the period of time when a plan can be purchased or changes and updates can be made to an existing plan for the upcoming year, as we touched on earlier this morning. Please note that for any changes or new plans you want effective January 1st, they have to be submitted by December 15th. Next slide, please. A special enrollment period is the time outside of the yearly enrollment period when you can sign up for health insurance. A consumer may qualify for an SEP if they've had a certain life event, including losing health coverage, moving, getting married, having a baby, or adopting a child. Depending on the special enrollment period type, a consumer may have 60 days before or 60 days following that qualified life event to enroll in a plan. And again, as we touched on earlier, some of those examples are losing existing health coverage, turning 26 and losing coverage through a parent's plan, getting married, getting divorced, having a baby or adopting a child, a death in the family, you move to a different zip code or county, or a student moving to or from the place they attend school. Next slide, please. We reviewed this slide in the previous presentation. We also do require an insurer offer the same plans off exchange in the individual market as well. And the interactive map that you'll find the link to on this slide is a great tool to help you know what plans are available in which counties. Next slide, please. So we've come to our next polling question. Special enrollment periods are available for individuals when they A, are no longer eligible for Medicaid, B, receive a promotion at work, C, find an insurance plan that they like better, or D, want to change their primary care doctor. So again, we'll give you 30 seconds to answer. About 5 more seconds. Okay, so the answer to this one is A, are no longer available, or excuse me, no longer eligible for Medicare. Next slide, please. So we talked a little bit about the requirements surrounding an insurance contract yesterday. So just to recap, the laws and regulations apply to all insurance policies delivered or issued for delivery in the state of Wisconsin. An insurance company has been notified if The company's authorized agent has been notified by or on behalf of the policyholder or insured and provided with sufficient information to identify the policy in question. Every insurer is bound by an act of its agents performed in Wisconsin that is within the scope of the agent's authority. Insurance coverage is issued based on the applicant's representations. Representations are oral or written statements made by an applicant. Wisconsin consumers are provided with privacy protection for medical and financial information. And insurers are required to notify their insureds of their rights to file a complaint with the Office of the Commissioner of Insurance regarding problems they may have with their insurance. The notice is required once for each policy or certificate issued by an insured. Next slide, please. Continuing on with insurance contracts, regarding the notice of claim, proof of loss is to be furnished as soon as reasonably possible and within 1 year after the time is required by the policy. Example of this would be submitting a prescription cost receipt for something you had to pick up while on vacation when you return home. Regarding prompt settlement, unless otherwise provided by Wisconsin law, subject to an interest payment, an insurer must promptly pay most insurance claims within 30 days of receipt. Regarding a mistake, in most circumstances, unless otherwise provided, general contract law applies to mistakes in insurance contracts. Any of the following done without just cause and with such regularity as to indicate a general business practice constitutes an unfair claims method and practice. The failure to promptly acknowledge pertinent communications with respect to claims arising under insurance policies, the failure to promptly provide the necessary claim forms, instructions, and reasonable assistance to insureds and claimants, the failure to attempt in good faith to effectuate fair and equitable settlements of claims in which liability has become reasonably clear, and knowingly misrepresenting to a claimant pertinent facts or policy provisions. Regarding the right to return a policy, each line of insurance has a period of time for the consumers to return the policy without any penalty. Life insurance, for example, is 30 days after delivery for a full refund when the policy is sold as a replacement of an existing policy. For health insurance, a policyholder may return any individual health policy within 10 days after receiving it. If the policyholder returns that policy within the 10-day period, the insurance contract is invalid and all payments made under that contract must be refunded. The right to return must be printed on or attached to the first page of each individual policy. For grace periods, although an insurer may cancel a policy for non-payment of premium, a consumer is entitled to a grace period for the payment of any premium due. During this grace period, coverage continues. For health insurance policies, it is not less than 7 days for weekly premium policies, not less than 10 days for monthly premium policies, and not less than 31 days for all other policies. A consumer should always check their policy to see if their insurer includes a grace period policy provision, and a policy issued under the ACA and using the advanced premium tax credit will have a slightly different grace period as governed by federal law. Regarding grievances, if you disagree with your insurer's determination, you have the right to appeal through a grievance. A grievance is any dissatisfaction with an insurer offering a health benefit plan or administration of a health benefit plan by the insurer that is expressed in writing to the insurer by or on behalf of an insured. All insurers that issue health benefit plans must develop an internal grievance procedure. An independent review is the process in which an outside expert provides a second look at a benefit determination. The independent review process provides an insured with an opportunity to have a medical professional who has had no connection to the health plan review the dispute. The IRO assigns the dispute to a clinical peer reviewer who is an expert in the treatment of the disputed determination. The IRO has the authority to determine whether the treatment should be covered by the health plan, and the reviewer is not affiliated with the insured, the medical provider, or the insurer, and conducts an independent and unbiased review of the claim. Next slide, please. As we talked about yesterday, the definition of risk relating to insurance is the uncertainty of a financial loss. Risk tolerance is the amount of risk one is willing or wanting to take on by themselves or can afford to take on for themselves. Insurance is defined as a transference of risk. Often you will see lower premiums with group products, and the reason for this is the law of large numbers or pooling of risks. The insurance agreement is a contract and governed by contract law. The basic elements of a contract are an offer of coverage, acceptance of the coverage, consideration, also known as the money, and an intention to create a legal relationship. Next slide, please. So we've come to the portion where we're going to take a 10-minute break. Let's reconvene. How about around 11:08 or so? So let's go ahead and break right now. Thank you.
Okay, that is the end of our end of our break. Sorry about that. Welcome back. This is Amy from the Office of the Commissioner of Insurance. Let's start with mandated benefits. Long before the ACA and HIPAA, Wisconsin was a leader in consumer protections. The next slide discuss the mandated benefits that must be offered by health insurers to Wisconsin consumers. Here is a brief overview of each of these benefits. Handicapped children, health insurance covering dependent children must provide coverage beyond age 26 while the child is primarily dependent on the insured for support and maintenance. Insurers can require proof of the child's disability. Home health care. This provides coverage for the usual and customary fees for at least 40 home health care visits per year. Home health care may include intermittent home nursing care, home health aid services, various types of therapy, medical supplies, and medication prescribed under the home care plan. Skilled nursing care. Health insurance covering hospital expenses must cover at least 30 days of skilled nursing care to patients who enter a licensed skilled nursing facility within 24 hours after discharge from a hospital. Coverage may be limited to care that is medically necessary as certified by the attending physician. Kidney disease and transplants. Insurance covering hospital expenses must provide for inpatient and outpatient treatment of kidney disease, including dialysis, transplantation, and donor related services. Coverage for newborns. Health insurance must provide coverage from the moment of birth for a newborn child of the insured. The newborn shall receive the same coverage the policy provides for any children covered or eligible for coverage under the policy. Policies may require notification of the child's birth and payment of any additional premium within 60 days after the birth. Adopted children. A health insurance policy covering children must cover adopted children and children placed for adoption by the same terms and conditions as other children. Coverage for grandchildren. Health insurance providing coverage for any child of the insured shall provide the same coverage for all children of that child until the child of the insured reaches the age of 18. Diabetic supplies and equipment. Health insurance covers expenses for the treatment of diabetes and shall provide coverage for insulin infusion pumps, other equipment and supplies, insulin and other prescription medication, and diabetic self management education programs. Insurers may apply the same exclusions, limitations, deductibles, and co-insurance provisions applying to other covered services. Maternity benefits. If a group health policy provides maternity coverage for anyone covered under the policy, it must provide coverage for all persons covered under the policy. The mammograms. Women who are age 50 to 65 must be covered for annual mammograms, and women between the ages of 45 and 49 with 2 examinations by low dose mammography. Coverage is required regardless of whether the woman has shown any symptoms. HIV. Any health insurance providing coverage of prescription medication shall provide coverage for each FDA approved drug prescribed by the insured physician for the treatment of an HIV infection or an illness or medical condition arising from or related to HIV infection, subject to any deductibles or co-payments that would generally apply to other prescriptions. Hearing aids. This is required to provide coverage for hearing aids, cochlear implants, and related treatments prescribed by a physician or by a licensed audiologist for children under 18 years of age, and the child must be certified as being deaf or hearing impaired. This is subject to any cost sharing provisions. Contraceptives. Required to provide coverage for any contraceptives prescribed by a healthcare provider. Cancer clinicals. Trials. Health insurance is required to provide coverage of routine medical services for the treatment of cancer provided to an insured in a cancer clinical trial if the services would be covered under the policy if the insured were not enrolled in a cancer clinical trial. However, insurance is not required to cover the cost of the treatment or the drug the trial is studying. Dependents. Health insurance covering dependent children must provide coverage to an adult child of the applicant or insured if the child is under the age of 26. Mental health. Health insurance providing coverage for inpatient hospital treatment or outpatient treatment must provide coverage of inpatient hospital services, outpatient services, and transitional treatment arrangements for the treatment of nervous and mental disorders and substance use disorders. Coverage cannot be more restrictive for coverage of the treatment of mental health disorders or substance use disorders or substance use disorder conditions than the most common or frequent type of treatment limitations applied to all other coverage under the plan. Lead poisoning. Required to provide coverage for blood level tests for children under 6 years of age according to screening protocols established by the Department of Health Services. TMJ disorders. A policy providing coverage for any diagnostic or surgical procedure involving a bone, joint, muscle, or tissue are required to provide coverage for a diagnostic procedures and medically necessary surgical or non-surgical treatment for the correction of TMJ disorders. Breast reconstruction. Insurance providing coverage for a mastectomy is required to provide coverage of breast reconstruction of the affected tissue incident to a mastectomy. Dental care required to provide coverage for charges incurred and anesthetics provided in conjunction with dental care for a child under the age of 5, who has a chronic disability, or an individual who has a medical condition, hospitalization, or general anesthesia for dental care. Immunizations for children provides coverage for a dependent of an insured for appropriate and necessary immunizations for children under 6 years of age. The coverage may not be subject to any deductibles, co-payments, or co-insurance under the policy or plan. Autism spectrum disorders. Coverage is required for the treatment of autism spectrum disorders, which include autism disorder, Asperger's syndrome, and pervasive development disorder not otherwise specified. Coverage must be provided for evidence-based treatment of autism spectrum disorders if the treatment is prescribed by a physician and provided by qualified providers. Student on medical leave. Health insurance providing coverage for a person as a dependent of the insured because the person is a full-time student shall continue to provide dependent coverage for the person if, due to a medical necessary leave of absence, he or she ceases to be a full-time student. Contingent mandated benefits. What we mean by contingent is the mandate sets up a if-then requirement. Eye drops. Every health insurance policy that provides coverage of prescription eye drops shall cover a refill of the prescription eye drops if the requested refill does not exceed the number of refills allowed by the prescription. Oral chemotherapy. Health insurance covering injected or intravenous chemotherapy and oral chemotherapy is prohibited from requiring a higher copayment, deductible, or coinsurance amount for oral chemotherapy than required for the injected or intravenous chemotherapy. Colorectal cancer screening. Health insurance covering any diagnostic or surgical procedures is required to cover colorectal cancer examinations and laboratory tests for any insured who is 50 years of age or older, or any insured who is under 50 years of age and at high risk for colorectal cancer. Chiropractic, nurse practitioners, optometrists are required based on services covered. The insurer cannot discriminate what services the provider is offering so long as acting within the scope of their license. So, for example, a chiropractor should not be administering an eye exam to their patient unless they are licensed to do so. And lastly, coverage of the COVID-19 testing. The mandate specifies coverage prior to March 13th, 2021. Additionally, while under the COVID-19 public health emergency, COVID-19 tests prescribed by your doctor were covered by insurers with no cost sharing. Since the public health emergency ended on May 11th, 2023, private plans are not required to cover over-the-counter and laboratory-based COVID-19 tests. If you have private insurance coverage, coverage of these tests will vary depending on your health plan. The health plan may choose to cover the testing, may require cost sharing, prior authorization, or other forms of medical management. These are some of the key practices the office monitors. An advertisement should not exaggerate a benefit and shall be sufficiently complete and clear to avoid deception or the tendency to mislead or deceive. You need to avoid providing your opinions on companies or products. Educate the consumer so they can make the best decision possible for themselves or their family. What marketing practices are unfair? We touched on examples of these practices in our previous presentation. Unfair marketing practices include the following and are indicated on the slide. Unfair marketing practices include misrepresentation, even by omission or incompleteness, unfair inducements, unfair discrimination, restraint of competition, unfair restriction of contracting parties, choice of insurer, extra charges, attempt to unduly influence employers, an unfair use of official position. Misrepresentation, when an intermediary, their employers, or those acting on their behalf make a written or oral communication about an insurance contract, the insurance business, any insurance company, or an agent which contains false or misleading information. This includes information which is misleading because of incompleteness, filing a report with the intent to deceive the person examining that report, making a false entry in a report, making a false entry in a record, failure to make a proper entry in a record for the purpose of concealing information, and using the name, slogan, emblem, or related device which will or is likely to cause an intermediary to be mistaken for another intermediary in the insurance business. If an insurance intermediary distributes cards or documents, exhibits signs, or publishes advertisements which include misrepresentations and contain reference to a particular insurer that the person represents as agent, the intermediary's violation carries a presumption that the violation was also committed. Unfair inducement, trying to get a person to enter into an insurance contract by offering benefits, gifts not specified in the policy. Unfair discrimination, for example, charging different premiums or offering different terms of coverage based on anything other than allowed classifications related to the nature and degree of risk covered. Restraint of competition. It is illegal for any of the following persons to commit or agree to take part in any act of boycott, coercion, or intimidation which tends to unreasonably restrain the business of insurance or which tends to create a monopoly in the insurance business. A person who is or should be licensed in Wisconsin. A person who is an employee or agent of the person who is or should be licensed in Wisconsin. A person whose main interest is to compete in the same business as those persons who are or should be licensed in Wisconsin. A person who acts on behalf of those persons mentioned in the preceding sections. Free choice of insurer. If insurance coverage is required, the consumer's right to select an insurance provider and/or agent cannot be restricted. What is home solicitation selling? The rules pertaining to home solicitation are in uh, administrative, the Wisconsin Administrative Code, Chapter 20. Home solicitation selling means the solicitation or the offering for sale of insurance where the solicitation or sale is made by an agent at the residence or place of business or employment of the buyer or away from the agent's regular place of business. Home solicitation selling includes solicitations made directly or indirectly by telephone, person to person contact, or by written or printed communication, other than general advertising that indicates intent to sell insurance or services at a regular place of business. And we have come to our third polling slide of today. You will have about 30 seconds to make your selection. The following are examples for unfair marketing practices. Please make the correct selection. A, misrepresentation. B, unfair inducements. C, undue influence. Or D, all of the above. Again, we'll have about 30 seconds. Okay, most have indicated their selection. Yes, it is D, all of the above. The agent or insurer must ask each questions. Let's start this again here. The agent must ask such questions as are necessary to determine that the purchase of such insurance is suitable for the prospective buyer. This is an area where we can see a lot of complaints against agents, especially when it comes to dealing with the senior population. Make sure to take as much time as needed to ensure that the person you are talking to understands in full detail what is being offered to them. Per state law, The insurer is responsible for the acts of their appointed agents when it comes to marketing, selling, and servicing of their products. We had a complaint once where the consumer provided a written notice to their agent to cancel their policy, and the agent didn't follow through on sending that notice to the company. This wasn't discovered until months later. Normally, the company would not have honored that request, but because their agent had possession of it and did not act in an appropriate time frame, they were required by statute to backdate the cancellation. Short-term limited duration plans are not required to include specific ACA consumer protections. Some consumers may believe that ACA compliant plans offer and are priced to include unwanted benefits. Short term limited duration plans may offer premiums that are lower than the unsubsidized premiums for ACA compliant policies, but they expose enrolled members to additional healthcare costs in the form of cost sharing and non covered services. Price sensitive consumers lacking full information about available ACA subsidies may gravitate toward enrolling in low premium short term limited disability plans, despite their limited coverage protections and high out of pocket costs. In many cases, short term limited duration plans may not be the lowest cost option. For the many consumers eligible for federal premium tax credits and cost sharing subsidies, ACA compliant plan premiums will be lower or comparable to the short term limited duration plans and offer additional benefits and potentially less cost sharing. Marketing short term limited duration plans may sometimes be confusing or misleading. Short term limited duration plans often are sold as a benefit of out of state association plans. Short term plans that are marketed as alternates to comprehensive individual coverage based on affordability or any other reason should not be bridge coverage that meets the definition of a short term plan. OCI finds that an insurer or agent who represents a short term plan as compliant with the Patient Protection and Affordable Care Act, ACA, or as providing more than bridge coverage is engaged in unfair marketing practices. Healthcare sharing ministries are not discounted insurance plans nor traditional health insurance. They are non insurance entities in which members share a common set of ethical or religious beliefs and share medical expenses among members in accordance with those beliefs. As we touched on earlier, the member is required to pay any medical bill first and then post in a newsletter for other members to donate funds to offset that individual healthcare expenses. States can still apply to become a state based exchange or partner with the federal government for a state partnership exchange. In this form, oversight responsibilities are split between the state and the federal government. There are currently 17 states that have their own ACA state based exchanges, but Wisconsin is not one of them. Minnesota is the closest state based exchange, so be very aware where your clients are residing. Under the Affordable Care Act, the ACA, an insurance plan sold on the healthcare insurance exchange or marketplace must be certified by the health insurance marketplace, and once certified, it becomes a qualified health plan. QHPs provide essential health benefits, follow established limits on cost sharing, such as deductibles, copayments, and out of pocket maximum amounts, and meet other requirements. All qualified health plans meet the Affordable Care Act requirement for having health coverage known as minimum essential coverage. A health insurance company must offer a product off exchange to the public if it is offered on exchange. The ACA requires that all Americans have health insurance that qualifies as minimum essential coverage, comprehensive individual and small group health plans, most employer sponsored plans, and government plans such as Medicare all qualify as minimum essential coverage. Short term health policies and limited benefit plans such as specified disease, hospital indemnity, and other limited policies are not considered minimum essential coverage. Essential health benefits, or otherwise EHBs, are a set of healthcare service categories that must be covered by all comprehensive individual and small group health plans subject to the ACA. Again, plans offered on the exchange and off the exchange must cover essential health benefits. Essential health benefits must include items and services within at least the following 10 categories listed on this slide. EHBs also include all the Wisconsin mandated benefits that we talked about a few slides ago. The ACA provides that each state establish an essential health benefit benchmark package to serve as a minimum standard for plans required to offer essential health benefits in the state. Wisconsin's plan is called the Wisconsin EHB Benchmark Plan. The ACA provides a federal tax credit to help individuals and families afford health coverage purchased through the Health and Insurance Exchange. The premium tax credit can be taken in advance to offset the monthly insurance premium or in the form of a refund at the end of the year, as we have previously discussed. Cost sharing reduction is a type of financial assistance available under the ACA. It is based on an individual's income and paid directly to the insurance company. It helps to lower the amount individuals will have to pay out of pocket for deductibles, coinsurance, and copayments. But note, the cost sharing reduction is only available through the Health Insurance Exchange for individuals with incomes below certain levels and who choose a health plan from the Silver Metal Tier plan category. The ACA also includes permanent reauthorization of the The ACA also includes permanent reauthorization of the Indian Healthcare Improvement Act, which extends current law and authorizes new programs and services within the Indian Health Service. For American Indians and Alaskan Natives, the ACA helps address health disparities by investing in prevention and wellness and increasing access to affordable health coverage. After entering in information about an individual or a family, the healthcare.gov website will assist you in the next steps. If the system detects a person may be eligible for Medicaid, it will forward their information to the state agency for them to contact the consumer. We'll also determine when a consumer is eligible for cost sharing reductions or advanced premium tax credit. As we have previously talked about, the ACA provides a federal tax credit to help individuals and families afford health coverage purchased through the Health Insurance Exchange. Cost sharing reduction is a type of financial assistance available under the ACA. Wisconsin insurers also offer plans off the federal exchange. These may have similar coverage and can be less costly. As previously stated, a contract between a health insurance company and a consumer is where the company agrees to provide coverage applicable to the language in the policy in exchange for premiums paid and any out-of-pocket costs by the consumer. Make sure you understand frequent terms relating to health insurance policies. Terms such as deductibles, coinsurance, copayments, HMOs, PPOs, etc., are all terms in explaining to a consumer. Cost sharing is a term used in health insurance, so it's important to understand and to be able to explain the three out of pocket possibilities for a member that fall under the blanket term. Coinsurance is the percent of a billed service that you will be responsible to pay. Copayment is a set or flat fee that you're required to pay. Deductibles are fixed dollar amounts that you must pay before your insurance policy will begin to pay for covered services. Understanding the concepts of cost sharing is key to balancing affordability of the premiums and overall out of pocket expenses for the consumer. Again, taking the time to explain these possibilities to consumers will be key in educating them to make the best possible decision on what plan they are going to purchase. We touched on the summary benefits earlier in our presentation. This sample can be found on the healthcare.gov website. This is just a brief snapshot of a plan's important features. As we have touched on previously, HMOs offer the least flexibility but usually have the lowest monthly costs, where APOs are a bit more flexible and usually cost more than HMOs. PPOs, or preferred provider organizations, offer the most flexibility but typically can be the most expensive. We have touched on the first two bullet points in previous slides. To control the cost of prescription medications, the Wisconsin legislature passed a law in March of 2021 requiring pharmacy benefit managers, or PBMs, to be licensed and regulated by OCI. The goal of the oversight is to increase transparency, control costs, and protect consumers. Pharmacy benefit managers increase a patient's access to medications by negotiating directly with drug manufacturers or wholesalers. Here again is another example of the page 2 of the summary of benefits a company provides. Please note the information on this document outlines the member's costs for common medical services. These are the provisions often overlooked by consumers most frequently because they do not think such issues or sets of circumstances will ever happen to them or their family. For instance, maternity coverage is provided. However, some plans might not provide coverage for delivery of your baby if you travel away from home during the last 2 to 3 months of your pregnancy. Exclusions can also occur when a company feels a treatment or therapy is not medically necessary. As we have mentioned before, OCI cannot make determinations of the necessity of a treatment. In this example, page 3 of the summary of benefits, it provides some information on what types of services are excluded and covered under the policy. Here's the example, page 4, and it provides coverage examples for a member's cost for services under the plan. It can provide them with valuable cost sharing information. And here's our last polling question of the day. You'll have about 30 seconds to make your selection. Which of the following should be considered when selecting health insurance plan? A, premium. B, cost sharing, C, network and coverage, D, all of the above. Okay, looks like everyone is on top of everything today. Everyone said D, all of the above, which is correct. A consumer might benefit from a refresher on some of the elements of commercial insurance plan design, such as premiums, cost sharing, and differences in benefits and provider networks. Some individuals may think of reviewing the provider directories or search tools of the marketplace plans before enrolling to ensure that important providers are in network for them. As a navigator, you are trained to assist consumers to look at all their healthcare options through the marketplace, which includes conveying accurate, unbiased information so they can make informed decisions. This also includes completing eligibility and enrollment forms as well. Taking the time to educate and raise awareness about the federal exchange is vital to being successful every day in your role as a navigator. And that concludes this presentation. On behalf of Shelley, I'd like to thank you for having us provide you with this information, and we'd like to wish you the best of luck in the future.
All right, so if there's any questions, you can go ahead and put that in the live help. We will give about a minute for some of those questions to come through. Doesn't look like we are seeing anything right now. All right. So we are going to end a little bit early today. Thank you all for joining us. And the main conference, as a reminder, starts tomorrow. And we will see you all tomorrow. Thank you so much.